Have you ever felt a deep pain at night that does not let you sleep? You lie on one side, then the other side, but the pain still stays there. If this is happening again and again, it can be a big warning sign for your health. Not every night pain means cancer, but a pain that keeps coming back, feels deep, or gets worse while resting should never be ignored. Before we begin, please like this video and subscribe to the channel for more health alerts. Also, let us know in the comments, which of these pains are you currently feeling or worried about? Your body often speaks before a serious problem becomes bigger.
The problem is, many people call it normal aging, tired muscles, or just back pain. But sometimes the body is asking for attention. In this video, you will learn about night pain signs that need care, so you can understand what your body may be trying to tell you. Now, let's start with the first warning sign that many people miss at night. Number 6. Unexplained lower back pain is common. Many people feel it after lifting something heavy, sitting too long, or working all day. But this type of pain is different. This is not the usual backache that gets better after rest. This pain stays even when you lie down. Sometimes it feels worse when your body is trying to relax. That is the part you should notice. Normal muscle pain often changes when you move. You may feel better after stretching, resting, or changing position.
But unexplained lower back pain can feel deep. It may feel like pressure from inside, not just soreness on the surface. It may wake you up at night or stop you from sleeping well.
If yes, do not panic, but do not ignore it either. Pain like this can have many causes. It may come from nerves, bones, inflammation, infection, or other health issues. In rare cases, ongoing unexplained pain can also be linked with serious disease. Cancer Research UK lists unexplained pain or ache as one possible general cancer symptom, and Mayo Clinic also advises medical attention for persistent, unexplained muscle or joint pain. Here is a simple step. Track the pain for a few days. Write down when it starts, where it hurts, and what makes it worse. This small note can help during a checkup. And remember, the biggest clue is this: pain that does not calm down with rest deserves attention.
Number 5. Localized swelling pain. A common issue that many people ignore is swelling or a lump that doesn't seem to go away. At first, it might seem harmless, like a bump from a minor injury. However, if you notice a lump or swelling that stays in one place, doesn't move when you touch it, or starts to feel painful, especially at night, this is a sign that your body may be trying to alert you to something important. Pain from swelling is usually more noticeable when you're resting, which is why it often gets worse at night. The quiet of the night makes the pain more noticeable, and if it's throbbing or pulsing, it could indicate something more serious. Localized swelling pain isn't something you should dismiss.
While it could be something as simple as a minor injury, it can also be a warning sign of other health issues. The key thing to notice is that if the swelling or pain doesn't improve over time, or if it starts to feel worse, it's time to take action. If you're feeling a throbbing pain in a swollen spot that doesn't go away, it's important to seek professional care immediately. A doctor can help determine the cause and guide you toward the right treatment. Don't wait for the pain to get worse. Early detection and care are the best ways to stay healthy.
Number 4. Mid-back spinal tenderness. Another type of pain that's often overlooked is tenderness or soreness right in the middle of your back, along your spine. This pain is different from a typical muscle ache, and it can be concerning when it doesn't go away after resting. While muscle aches tend to improve with rest or stretching, tenderness along the spine, even when you're lying down, could be a sign of a deeper issue. Pain in the middle of your back that feels sharp or tender when you touch it could indicate problems with your spine or the surrounding nerves. Unlike a simple muscle pull, spinal tenderness may not ease up as easily, and it could be constant or worsen over time.
Even though many people experience some back discomfort, persistent pain that doesn't respond to rest deserves attention.
If you're experiencing mid-back tenderness, don't hesitate to get a professional checkup. A doctor can evaluate the area, and early intervention can help prevent the problem from worsening. By addressing these issues early, you can take steps to maintain your back and spine health in the long run.
Number 3. Unilateral hip pain. Hip pain can be common, especially as we get older. But when the pain is localized to only one hip and feels deep inside the bone, it may be something worth paying attention to. This kind of pain often feels like a dull ache that doesn't go away, even with rest. It's especially noticeable at night when you try to sleep. The pain may make it difficult to sleep on one side, and sometimes it even wakes you up in the middle of the night. The most concerning part of unilateral hip pain is that it doesn't seem to improve over time. If the pain only affects one hip and doesn't get better with simple rest or stretching, it might be more than just typical muscle fatigue.
This could be a sign of joint or bone issues, and it may point to a deeper underlying cause, especially if the pain persists over a longer period. For many people, the pain can get worse when lying down, which prevents them from getting a good night's sleep. A good night's sleep is essential for recovery, and when this kind of hip pain interferes with rest, it could be a signal that something isn't right.
Number 2. Intense night sweats. Waking up in the middle of the night drenched in sweat is not just an uncomfortable experience. It can be a sign that something serious is going on inside your body. Night sweats are different from regular sweating. They happen when your body becomes overheated while you're at rest, often during sleep. The most concerning aspect of night sweats is when they occur without any obvious cause, like a hot room or extra layers of blankets. This kind of sweating happens when your body is working overtime to deal with something internally. It could be a sign that your body is trying to fight off an infection, inflammation, or even other internal health issues.
Often, night sweats are accompanied by feelings of fatigue or discomfort, and they may not be just a result of stress or a busy day. When night sweats are persistent and happen regularly, it's important to take note of any additional symptoms. These episodes of sweating can cause disturbed sleep, which affects overall health and energy levels. It's essential to track these symptoms and pay attention to how often they occur. The body's signals are meant to alert us to deeper issues, and consistent night sweats should be taken seriously.
Number 1. Unexplained rapid weight loss. We all know that losing weight can happen for many reasons: a change in diet, increased exercise, or a new routine. However, unexplained weight loss, where you shed pounds without trying or dieting, can be a much more concerning issue. When weight loss happens rapidly and without any change in lifestyle, it's your body's way of signaling that something may be wrong internally. This kind of weight loss happens when your body starts using energy in unusual ways, and the most common reason is that your body is being drained by abnormal cells or processes inside.
These cells, which could be linked to a variety of health conditions, steal nutrients from your body, making you lose weight even though you're not doing anything different. Often, the weight loss comes with fatigue, loss of muscle mass, and other health issues. The troubling part is that this weight loss might happen so gradually that you don't notice it at first. But when you do, it's usually a sign that your body is working harder than it should to fight off something hidden. This could be a symptom of many underlying conditions, and you should always pay attention to any unexplained weight changes.
This video is for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a healthcare provider if you have any concerns about your health. Before we begin, please like this video and subscribe to the channel for more health alerts. Also, let us know in the comments, which of these symptoms are you currently experiencing or concerned about?